to now share. I don't know. I think like.
More people.
So how do I know I'm recording?
Just go.
Pause recording, stop
Yeah,
recording. Okay,
Yes,
so
so
we're
we
good.
must be, by default, we're recording.
Should be a
I
little,
just
should
pressed
be a
it.
little icon. Pulsing, a little icon.
Yeah, there it is. It's the red dot that's expanding and it's
Oh,
right
I
there.
see it. Okay.
And the green
so we're
bar?
good to
Oh, I
go.
see
Yeah.
now.
Yeah. Okay, well, so, I'm going to introduce, welcome everyone. Welcome everyone who is, do I stand this way? Welcome everyone who is with us online and everyone who is here in the room. I'm really pleased to be here presenting Professor Tanusha Raniga to do a lecture for us. And I just wanted to say before I introduce Nellie Ledger, who is our Associate Provost and Dean of the School of Graduate School of Education, I just wanted to say that I'm just so pleased to have my friend and colleague with us here in the US for the first time. And for those of you who are in the audience today, I think to me what's most meaningful is that she is a social work practitioner working with women in poverty, HIV infected, and youth in South Africa who took that training and brought that viewpoint into academic training and policy analysis. And now she works in the area of policy development and social development at the University of Johannesburg. And you're going to hear a little bit more about her background. So now I'll introduce Nellie to give our warm welcome and introduction.
Thank you. Good morning, Professor Raniga. Good morning, everyone, or good afternoon. Is it already
Yes,
afternoon? I'm
just-
sorry.
just barely.
Hello to everyone that is online, in person, students, alumni, practitioners, faculty, leaders in the field of social work in the US and internationally. It's a pleasure to have you with us today. I wanted to, on behalf of the Provost Office and on behalf of the Toro University leadership, extend a warm welcome to you here. I wanted to also add that the social work program at Toro is very dear to us, since it's very closely related to and derived from the mission statement of Toro University. And I wanted to take a moment just to read just one piece of the mission statement from Toro University, where the statement of mission and values, where we say that one of our core values is service to the community and access to education. I noticed in reading about you, Professor Raniga, that upholding social justice and service to the community is very dear to you. I see that as an academic, you have always embraced the close connectedness between teaching, research, and community engagement. And that speaks very closely to who we are also and what the social program work is at Toro University. So it's very right up our alley. There are very, very strong affinities between the work that you do and what we embrace in terms of our practice as educators and practitioners. The approach at Toro in the social work program and for the university as a whole is very inspired in the idea to serve the underserved, to serve a diverse population in the US, and international perspectives are very useful for everyone, not only for our work in terms of teaching and learning, but in terms of the scope and range and potential impact of social work in New York and in the world. So with that, it's great to have you among us today, and we look forward to learning from you.
Thank you very much.
hour.
Thank you. Thank you, Dean, and thank you.
And here's the camera.
Okay. So good morning, everyone. And I want to say thank you very much for this really heartwarming welcome and for hosting me today. I'm really, really excited. This is my first trip to the US. So I started off in Boston and did some work with colleagues at Simmons University and Boston College's School of Social Work. And then I was at Columbia University, and now I'm here. So it's been a real whirlwind of a trip, but really very, very heartwarming. And I want to say in absentia, thank you to to Dean Nancy Galina for also hosting me, and my dear friend, Professor Jennifer Zelnick. We go back a long way, collaborate in social work. So a little bit about me. I started off as a social work practitioner for about 8 years in the NGO sector, and then moved into the world of academia, where I did my PhD at the University of KwaZulu-Natal. I was then appointed up to a senior lecturer position, and I was there until March 2017, from 2007 onwards. In June 2017, I moved to the province of Johannesburg, or Gauteng, we call it, and and then was the associate professor, and now been promoted to full professor since 2020. And recently, I've been appointed as the lead researcher within the Center for Social Development in Africa. So a lot around welfare and social development is up my stream. I'm mentoring and supporting postdoctoral students as well as PhD students, and we welcome exchanges of master's and PhD students within my research center. So please stay in touch. That's my email address if you are interested in visiting or pursuing a postgraduate program at the University of Johannesburg. So thank you again also for giving me this opportunity to share some of the very, very important research that I'm involved in, and that's very close to my heart around gender justice and social policy, particularly around social protection policy. And my research is focused around the experiences of poor women or unemployed women in South Africa. More recently, I was sharing with Professor Zelnick that my work has expanded within the Africa continent, and I have master's and PhD students who have done work within what we call the SADC region, which is the southern part of Africa, which includes Botswana, Swaziland, Zimbabwe, students from Zambia, and then more further West Africa in Ghana and Nigeria. So my title for my presentation is really around social protection policy and poverty experiences of women in South Africa, and my collaboration with work that I've done in an NGO who really facilitates business training and entrepreneurship programs with unemployed women. Sorry, clicker. It's not really at the top. I can just advance the slides for you. Go down. That was working. Is that? Oh, now it's back. Great. Okay, so for those of you that know, South Africa is made up of 9 provinces, and as I said, I lived and grew up in the bright green province on the map, which is KwaZulu-Natal, and more recently I moved to Gauteng, which is about a 6-hour drive from KwaZulu-Natal to Gauteng. And just to clarify, the country named Lesotho is not part of South Africa, but we have a close collaboration, but doesn't constitute part of the provinces within the country. So the persistence of gender inequality, you know, in the post-apartheid era in South Africa has really increased in terms of the feminization of poverty. And we know this is like a really not just a Africa-based problem or a South Africa-based problem, but really expands within global South countries. And it's a major concern for us as social policy advocates, as well as social work practitioners. So for me, the paradox has always been that even though women make up more than 50% of the world population, make up also 70% of the world's poor. Professor Antoinette Lombard, who is an excellent social development prominent scholar in South Africa, argues that while there are significant differences in the life experiences of there's some noise. Everybody?
Can everyone please mute?
To comply with federal privacy regulations.
You should be able to
We'll ask
mute
you
them
to
like that.
verify some personal information.
Oh, yeah. No.
Thank you for calling VNS House.
Okay, thank you. Yeah, so I was saying that I think what is really important and significant to take note of is that the life experiences of different groups of women in the continent and within the various nation states in the Africa continent is not homogeneous. They really, women do share some intersectional kind of key structural challenges such as race, class, and gender. And we know this is very, very connected to patriarchy and the traditional kind of restrictions that women have, been subordinate and disadvantaged in respect of access to education, to family wealth, to social work services, and even property rights and land rights. Okay, so now the it's not working again. Yeah. Sorry.
No worries.
So in sub-Saharan Africa, as I was saying, some of the key kind of countries that I focused on, as mentioned earlier, within Botswana, Zambia, Swaziland, Zimbabwe, really share. And I must say this has been the pattern and the trend also within the post-COVID pandemic era, that 8 out of 10 women are considered to be in very, very precarious job positions in the labor market, and particularly within the formal work sector. The discrepancy between the annual income of women and their male counterparts, the wage gap still exists in South Africa. The average salary, I can say, which is really about $5,000 per annum, is much less by paid to females, while males earn particularly about double that, you would be able to see. And I think those statistics have really remained, if not gotten worse within the post-COVID era. Bridging this income gap remains a key challenge for us, especially for African females who have an average annual income, as I say, of about $4,600. And I really want to appeal to my colleagues who are sitting in the room and virtually to kind of just think, would you be able to survive on that $4,600 kind of, or up to $5,000 a month? And in my country, really, the answer is no, because the rising cost of living, and if you followed in the media as well, South Africa is experiencing very high infrastructural challenges and a crisis with regard to electricity. So women's role in the informal economy, and I just want to say that within the informal economy, I'm referring to women within two categories. One, women that are working on contract, who have less than 40 hours of work part-time in the economy and do not have any kind of formal contractual employment agreement with the employers. And they also don't have any labor protection. And the second category of women that I've worked with include women that are running small businesses. A lot of the women that I've worked with have really had to initiate in entrepreneurial projects to supplement the kind of menial cash transfers and monthly income that they receive from the state. One of the biggest kind of social protection and poverty alleviation strategies that we've had in the post-apartheid era has been the social grant system. So it has been really encouraging to note that more than 50% of unemployed women are running some sense of their own business in the informal economy, and there's a lot of empirical evidence to show that. Despite the increased visibility of women in the informal economy, we're still having to advocate for changes in the private, financial sector, where women don't have much access to microcredit and loans. And this is really shown in my own research that it has it's a major obstacle in terms of sustaining their businesses, especially in this post-COVID era.
Can I raise one point just so that people understand what we're talking about? Because we don't talk about the informal sector so much in this country. So maybe just if you can give a couple of examples of what kinds of businesses people might be starting in the informal sector.
Okay. So it's mainly around in the agricultural sector. So a lot of women do run like the community garden projects where they're growing fruit and vegetables, and then are selling informally within the streets of the big city areas as such. And then, so a lot of the women I've worked with have been street vendors as well. And then many of them are within the textile industry as well, where they're doing sewing and making of garments and, just taking on informal contracts with schools to do uniforms for kids and so forth. So that's another bigger sector that women are engaged in. And the third one, it would be catering and food industry, where, they're baking and cooking or selling within a little catering food business. So those are the three kind of major areas that the women that I've worked with have integrated in. So to talk about a little bit about the social protection systems that we've used, and this is not unique to South Africa, it really spans across many of the countries beyond just, as I said, the southern countries in Africa. So we really are very interested in African indigenous social protection systems and how this can really merge or integrate with the formal social protection systems put in place by the various governments or nation states. So historically, African indigenous social protection systems have included the extended family and kinship relations, community support networks, and churches and faith-based organizations across religious backgrounds to really fill in the gap in terms of assisting individuals, families, groups, and communities in times of crisis and beyond. So in South Africa, social grants, which really comprises cash transfers from the government, are provided to various categories of vulnerable in society, which include children, single mother households, children, orphanal and vulnerable children, foster care kids and adoption children that have been adopted, older age persons 60 and above can qualify, as well as those individuals that are either physically or mentally challenged can have access to state social grants. As survival strategies, single mothers use a combination of the indigenous social protection systems and the access to the formal cash transfers from the state to really just cope with their survival needs. There's much emphasis placed on cash transfers enabling single mothers to engage in livelihood strategies to supplement the menial cash received from the state. And a lot of my research over the past, since about 2016 onwards has really focused on this, the kind of experiences of mothers. So both in the global North and South countries, governments have put in place social protection systems to mitigate poverty and income insecurity for citizens. While much efforts by government and development partners have focused on increasing cash transfers to the vulnerable, as well as by providing access to free health, education, and social services, there's been very little attention given to how indigenous social protection systems, so what we lost in colonial times, so reclaiming pre-colonial kind of strategies, that was really communitarian and very much, located within women's roles in the communities, especially within the African continent. So research has shown that the African indigenous social protection systems and formal social protection systems are interconnected, and they reinforce each other as both systems are based on African values of solidarity, collective responsibility, a sense of interconnectedness and interdependence with each other, equality, unity, care, and compassion, which are really core values for us as social workers and within the social development sector. So the number of women engaged in businesses has increased, and I think this has been primarily because a lot of opportunities have been provided by the NGO sector in particular within South Africa, and has emerged as a key developmental strategy in low-income communities, influencing public policies, societal attitudes, and socio-political processes. Social entrepreneurial activities integrate the public-private profit-making and non-profit sectors. And the emphasis has been on this kind of hybrid model, or what we call the pluralistic welfare model, and has become the backbone to a lot of the economic sustainability projects of women in the informal economy in South Africa. So I'd like to change a bit of focus now and tell you a little bit about my own research and what we had did. It was really, I partnered with an NGO based in the Western Cape in South Africa, where they looked at really providing business training and psychosocial support to unemployed women within the country, and they located within 5 various provinces. My study was particularly located within the sub-office in the Gauteng or Johannesburg area. So it was really to explore the role of this NPO in the promotion of women entrepreneurship in Gauteng, to review we call the Clothing Bank, the 2-year kind of enterprise development program that they involved women in, and to see how it was received by the women and what kind of challenges the women had experienced being part of their program. So the objective of the study was to explore how the Clothing Bank had contributed to the women in terms of their human capital, social capital, financial capital, and physical capital development. I used the sustainable livelihood framework as a strategy to conceptualize my study. And this really talks about in poor communities tapping into untapped community resources and nurturing positive social networks. So it has a very close connect to social development theory, which talks about merging psychosocial support with economic support to really facilitate and assist female-headed households to increase their income security and reduce vulnerability. I want to also acknowledge Professor Leila Patel, who's a mentor to me, and she was really instrumental in setting up the Center for Social Development in Africa, where I'm now located. And really, a lot of her prominent scholarship argues that in order to improve the livelihood outcomes of the poor, through increasing income and reducing vulnerability, we do need to strengthen social networks, improve resources and opportunities for a more sustainable household. So the Clothing Bank, a little background about them, is a registered NGO and was founded in 2010 in Cape Town. The organization really sets, as I said, a platform for unemployed women to become financially and socially independent through engaging in entrepreneurial activities. It exposes the unemployed woman to the practical and theoretical aspects of running a small business, while also providing them with training, psychosocial support, and mentorship. So the context of my study was really within, as I said, the province of Gauteng, which is considered the economic hub in relation to the other provinces in the country. And I was just checking last night, we have now more than about 15.2 million people living in the province. So it is one of the most populous provinces in South Africa. But also it is where we also facing a very high unemployment rate. And this has, as I said, escalated within the COVID-19 pandemic period. So it's not surprising that some of the developmental challenges are high levels of crime, high levels of poverty, inequality. As I said now, and this is not just unique to Gauteng, but can really be a national, it is a national kind of concern. And in addition to all of this, it is really now we're facing service delivery and infrastructural and an energy crisis challenge. So the women themselves were, participated in a 2-year kind of structured training program, which included, looking at business training, self-awareness, marketing, good literacy skills, to really just provide a platform for them to become confident business persons and to ultimately become financially independent. So I used a multi-phase triangulated research design through a combination of quantitative and qualitative approaches, and to really just look at the promotion of social entrepreneurship in Gauteng. I'm going to focus for this presentation on phase 2, which was really the qualitative part of the women's experiences. So it's a subset of the data that I'm presenting. So a lot of the women employed were, that we selected, we did so using purposive sampling and convenience sampling. And the criteria that they used was really that they had to be part of the Clothing Bank for at least 3 years, that they had completed the training, and that they were living in low-income communities. And there were 2 kind of prominent themes that came out of the qualitative data analysis. The one was looking at the benefits of the training by the NGO. And this is some of the kind of views that the women shared, which you would be able to see was really very positive. So it gave them a really good opportunity to kind of just have the option to be self-sustainable. Some of the social capital benefits was that the women felt that coming together as a collective and working together, forming a support network during the training and learning from each other, really helped them when they got out to run their own businesses, and they were able to still continue and stay connected and share their kind of challenges and troubleshoot together. But all of the women really raised concern about the lack of funding to sustain their own businesses. I think this is a really big challenge, whether you have a business in the formal economy or in the informal economy in South Africa, because as I said, access to loans and microcredit is really very dismal. And a lot of them had said it was really difficult for them to even attend training when they had to kind of just look at their budgets, and priority was really for buying food at home or taking care of the children's needs. So it must be noted that the sustainability of social entrepreneurship or business projects depends on access to microcredit and funding from the private sector as well as from government, who are primarily responsible for local economic development and to mitigate the feminization of poverty. So what does this mean for us as social workers? Well, really, the clothing bank is one example that served to unite and involve women in economic and social activities and provided an opportunity for the women to really just get into the market of the informal economy and to access resources that they would not have been able to obtain. All of the women acknowledged that their participation in the clothing bank led to an improvement in their own social status, their household incomes. It affirmed their own confidence as sole income earners in their families. The voices of the women in my study really highlight that enhancing human capacity through ongoing interpersonal training, through business skills training, through building partnerships and social networks within and outside of their own communities are useful practices for sustaining entrepreneurial activities. And I would say that from my home country, that transformative interventions really need to include, and this is something that I'm doing with the women currently in other studies, that we looking at establishing a business forum to assist women to network online as well as now in person, to come together monthly, to really just advocate and lobby for funding and from both government and the private sector. Policymakers must improve legislation pertaining to women regarding property rights and their liberty to be entrepreneurs. Government must improve access to literacy and business training programs with the focus on enhancing gender equality in the economy. And I also think that national policy changes must look at really expanding awareness on the significance and the valuable role that women contribute to the informal economy, a systematic kind of integration of African indigenous social protection strategies and formal state social protection systems should be included in the broader comprehensive social protection policy and practice. NGOs, social work practitioners must collectively lobby for financial and technical resources required to support and encourage women-led businesses, especially in low-income communities. And I want to say thank you very much for listening to me.
Thank you so much. I'm gonna see if we can look at our participants. We do have some time left for questions and discussion. And Eric, do you know how I make this bigger?
You could do stop sharing.
Oh, stop share.
And that will enlarge the screen.
Did that do it?
No, enlarge the middle box up on
Now
top.
I do this.
There you go.
Okay. Hi, everyone. So I don't know if we have some questions in the chat. So it's mainly just people saying hello, but I'm going to put that up too so I can see if anyone wants to put a question in the chat, or if anyone wants to unmute themselves and ask a question or raise a hand, feel free to do so as well. And of course, we have people in the
I
room.
was gonna say,
So,
we both have questions.
okay,
right?
so maybe we'll start here in the room and we can take it from there.
So I have lots of questions because this is, I don't know that much about South Africa other than what I hear in, general news. So when you say that this area has a much larger population now, is it because people are moving into the area, or is it an explosion of the population as opposed to relocation of people? And I'm asking this because I know you're talking about family and community links. And I know in an industrialized country like ours, we've seen how sometimes when people move into cities for jobs, they also lost all those social supports. So I'd just like to know a little bit more about that province and what the situation is there. That's one of my main questions.
Oh, thank you very much. That's a lovely question. I think it's a bit of both factors. The one is that we've seen an explosion of the population over the COVID pandemic, a lot of baby boom.
Nothing else to do.
Yeah, and then the second has been that over the past 2 decades, we've seen an influx of what we call female migrants within particularly, and we call that the feminization of migration in relation to the connect of feminization of poverty. Because particularly within the southern African countries that I mentioned, there has been an influx of people from Zimbabwe and Mozambique, from Swaziland that come into the country because of major political strife and uncertain economic climate within their own countries, and have come into South Africa, so there has, and a lot of the population, I know from another study that my master's student had completed, it looked at undocumented single mother experiences within South Africa. So so there has been a lot of complexity in terms of a fight for resources, because particularly in the province of KwaZulu-Natal, Professor Zelnick is very aware of it within our own research, that there were a lot of kind of tensions, interracial tensions, as well as migrant tensions within populations that are really poor and struggling to survive and are fighting for the same kind of resources, economic and access to health, education, and social services.
I have another question, which is based, you were describing how, who can live on $4,000 a year, of course, but what type of support, when you say there is government subsidies, what level of support is there?
Meaning the size of the social grant.
Okay, so it kind of differs. If I can quickly convert it, for older person 60 and over, they probably get about $112 a month, which is about 2,000 rands.
Right.
And for children, it's now about 460 rands, which is maybe about $30 or something a month. So you want to ask yourself, can I even raise a child for a day on that amount?
Right.
If I'm 60 and above, can I even survive on that? So that's the kind of real questions we are asking as social workers in South Africa. And I believe that there needs to be a lot of advocacy for change, for in terms of one of the positive outcomes over the COVID period was that we never had a social grant dedicated to people that were unemployed in the country. So those between the ages of, say, if they stopped working at 50 and could only collect a pension at 60, then within that space, and we're dealing with high levels, as I said, it's like almost a 35% unemployment rate in our country. So 1 in 3 economically active people are really unemployed. So it means then that within that gap, people didn't have access to any sense of social protection, So over the COVID period, where we had the health crisis, which really connected very much to as an economic crisis and survival, the South African government introduced what was called the social relief grant. which was 350 rands.
And it's still going, right?
And it's
They-
still going, yeah, in this post period, they say it's gonna be until the end of this year, financial year, but I'm not sure it has been extended. And I'm doing, we've just done a little study in a very rural area in KwaZulu-Natal, looking at the impact, the economic impact of the social relief grant and other state grants on female-headed households, so single mother households. And part of the kind of data that is showing up is that women are really, there's deeper levels of poverty and hunger, increase in malnutrition with children. And it's just, you know, all of the kind of challenges that are raised in my presentation around poverty, inequality, unemployment, high levels of unemployment, really perpetuated over COVID. And it's now we're dealing with crisis levels, you know, so it's really difficult. Yeah.
Is it okay, Eric? Can I bring just one question
Absolutely.
from our group here? So Mildred wanted to know about childcare issues for the women in your study. I would imagine, Mildred, clarify if I've got it wrong, but I think, you know, that's a great question for women that are working in the informal sector. What do they face for childcare issues? How do they tend to care for
Yeah.
their children as they're
Yes,
starting
thank you.
business?
So thank you, Mildred. I think that's an excellent point to raise because I can send you some of my published papers as well through Professor Zelnick, where I argue that, and it shows within the data that the woman really struggled to balance
Yes. Mm-hmm.
kind of home and childcare responsibilities, as well as running the business like almost 7 days a week and being you know, flexible hours, working 10, 12 hours a day, while also having childcare responsibilities. And they created, fortunately, some sense of support networks. It was easier where women who came from communities had access to early childhood development centers where they could leave the kids during the day. But it also meant that it was just for maybe 5 or 6 hours in the day, and that kind of just then spilled into like if they were doing, you know, after hour work and so forth, or working weekends and so forth. So it wasn't ideal. So one of the key things we also recommend is for an increase in childcare protection policies and services for single mothers in particular, you know, and that the government should look at providing additional relief grants for that, yeah, or subsidies for kids that go to.
Okay, thank you.
I just want to say that this is very, very interesting because when you talk about that, that reminds me, you know, here in New York City, a lot of undocumented Chinese immigrant, you know, parents that they send their infant to China. But for those, you know, who decided that they will keep their children here, they're also facing the issues in terms of poverty, in terms of arrangement of the child care. So as you said, that they're creating all these informal network in order to help with the child care, either by the older generation or someone that they have known.
Yes,
I
yeah.
think it's so
Oh,
interesting.
that, yeah, and thanks for sharing that, Kevin, because it's been a pattern for in the Africa continent that we know grandmothers always step in to take care of children. But when we've had a lot of that generation really lost through COVID, you know, and we found that more than 1 million people lost their lives in South Africa due to the coronavirus. Yeah, that diminishes the kind of community and family support, and particularly with regard to childcare support within the following generations.
We have a question, and I don't know, Shalene, if you want to speak your question, or I can just paraphrase that. The question is about whether relief grants are also meant to cover healthcare costs or how healthcare costs are covered. So maybe you can talk a little bit about the healthcare system in South Africa that's available to these women, because
Yeah.
you guys at least have something that we don't have here. in the US, correct?
Yeah, so.
Begins with a U.
So one of the, thanks for that question. One of the benefits in the post-apartheid era was, in the new democracy within the last 29 years in my country has been that poor women and South African citizens do get access to free public health care, which really does kind of cover. But I think the paradox, and Professor Zelnick's research will probably tell you a lot more about it, is that the kind of paradox is the quality of the care is really very, very poor. There's not consistent access to medication, to proper quality care. If you take a child to the public clinics or healthcare hospitals and so forth, and it's just deplorable because also of diminishing kind of resource and budget supports over the years.
Well, yeah, I mean, I think it really also highlights all the other impacts into public health care that have to
Yes.
do with medication stocks and electricity, as you're saying, and, labor practices and, staffing and so,
Yes.
and infrastructure. So there's so much to it. And, actually one of our students, Janet Lazarus is here, is also from South Africa. And she and I were together with some South African and students in our program here at Toro. And the issue of the healthcare system came up. So we talked for quite a while about the pros and cons of different types of systems and what you gain and what you lose. But I do think it is worth for everyone to understand that even though we're talking about a country that faces more economic challenges, they have been able to make some policy changes that we've been unable to make in this country in terms of providing access to, a basic system of public health and hospital treatment, clinic treatment.
Yeah.
So I had a different question, which I want to offer. I'm interested in the model of the TCB. I'm curious, is that the one that you've studied, is that the only one that exists in South Africa, or are there multiple examples of it? And then you talked about multiple streams of funding potentially to support such things. Was the clothing bank, what was the source of funds to get the clothing bank off the ground? And are there prospects for private or governmental funding for, for ongoing purposes?
Thank you for that very important question, Eric. Within the clothing bank, I think they were very unique that they were self-sustaining. So they don't receive any government subsidy or support. So they really get funding from the private sector and multinational companies that exist within South Africa, as well as international donors. And I think what was really key was that there were 3 women that started this kind of project, and they were business persons who worked in high-profile companies in the private sector in South Africa. And when they retired, they said, let's get together and pool our strengths and experiences and start this clothing bank. So it was really calling for big companies like Edgar's, Woolworths, and so forth that exist within Mr. Price and so forth, which are big clothing companies in the private sector in South Africa, where they got donations from these organizations to say, give us all of your clothing that's not reject, but really that not quality assured, and we would take them as donations, and then they would distribute it or train the women within a period of 18 months, and then gave them an opportunity to really just buy these goods at a very low cost. So they could then resell them in the low community. So it was really started on that kind of a basis. And train the trainer model, where they provided this kind of business training. And I think what impressed me as a social worker was that it had not just the financial literacy and the business training that was included within the 18 months of their life skills education, but rather it included psychosocial support where they had counselors and social workers being available for the women who came in with a lot of their own personal trauma. Many of them were victims of gender-based violence, intimate partner violence. We're dealing with very, very, very deep kind of seated trauma in their own personal lives, which would have affected, obviously, their kind of economic sustainability.
Including high rates of HIV.
Correct, yes, and high rates of
So it's a
HIV.
generalized HIV epidemic in South Africa. So
Yes.
very high number of people just in the general population are infected, including many women.
Yes, and single mothers. So it kind of provided that kind of holistic support, which really was, I think, one of the key factors in sustaining and being successful. Yeah.
I have a question that more from a human behavior framework. As you talk about the single motherhood, I want to know more about that in South Africa, about the parent-child relationship within such a context, how that affect their well-being.
Okay, so a lot of the women really were very, very, we used what was called feminist methodology and African feminism as part of my key, base of working with the women. So within the research frame, it wasn't just giving them a safe platform to really just talk about their life experiences and their stories, but really raising their consciousness that a lot of their own private life experiences were very connected to this kind of skewed distribution of resources, their own, daily struggles that they faced as poor women in terms of consistent kind of discrimination and hegemony and the patriarchal kind of systems within the informal economy, just negotiating their space and access to resources and goods and so forth. So all of that was like an interplay, and the very fact that they were also Black African women, meant that they were really at the lowest end of the social strata and were further disadvantaged. And that's why I say the intersections of them of race, class, and their own sense of locality, within the economic environment had a very profound impact on their daily struggles. So it was really about raising consciousness around that and providing that platform. And further from that, it was engaging them in getting involved in advocating and into some changes and transformative action, which I think as social workers, we need to play a much more conscious and active role in, advocating for the needs of the vulnerable and poor in society, and really not just being very micro and meso-focused, if I can say that, Jen, that it's really not an either or paradigm, but very much of a, like we argue within Afrocentric social work practice, that it is really an integrated method, that we have a responsibility to provide the micro-mezzo level intervention, but equally lobbying for change and advocating for change and macro level intervention strategies such as this is really, really important.
Question. I know you used in the first couple of slides that some of them have difficulty accessing microloans. And I always thought that, microloans were developed so that they could help people, start a business and they've been found to be very successful in the different parts of the world. Why does that barrier exist for them to access these microloans?
Yeah, that's a very complex one.
Oh.
Thank you for asking it. It's very, very relevant because I did some work in the East Africa region, and they are much better within Kenya, within the context of Uganda, as well as in Tanzania, would really helping women to access microcredit and loans and so forth, both within the private and the public sector. So in South Africa, unfortunately, there's been not a great synergy between the private sector and government and NGO sector. So it's still very territorial. And within the private sector, yeah, some banks have introduced access to business loans at very low interest rate. But the category of women that I worked with really don't even have high level literacy, you know, where they can fill out big forms and tedious administrative kind of processes, go through all that bureaucracy to really just access a loan. So in many of my presentations and papers, I really just think it's very, very important that that needs to still be advocated.
No, it's so interesting as you were talking about that. I think one of the things that's striking as an outsider is that in South Africa, the difference between the, you know, the inequality and the nature of inequality is really profound. Whereas in a country where it's more generally poorer, or, you know, the economy is not developed to the degree of sophistication of South Africa, the inequality maybe is not as stark and those difficulties may not exist the same way. It's again, like kind of a paradox. I think. Because here we have that too. We have people who are so poor that they are they're outside of the formal economy, really. They are outside, you know, we have a lot of that in New York. And so it creates almost this, you know, different tiers. And how do you reach those people with more formal programs?
For sure. I mean, I always say that, and if you visit South Africa, you'll see it quite blatantly, that we have two parallel worlds. You know, it's like the rich and the really privileged in society, and then the mass poor, you know. And so the economy is also within that frame where it's the formal work sector where, you know, people have good jobs, they pay taxes, they have access to private healthcare, and all the privileges within society. And then there's the mass poor, where 80% or more of people are really daily surviving day to day. And I think I'd like to make this point that, you know, it's very much within the limitations of global capitalism that we see that.
Probably the same thing here. So we're about to run out of time, but we have time for.
So just this actually, I wasn't looking to end anything, but just a technical point before people to sign off on their own, because people may have to run to other things. On the continuing education matter, we will be in touch with everybody through email to give you the instructions about how to ask for your continuing education credit, because we did offer 1 CE hour for today's presentation. If you don't hear from us by August, email me directly. And
Sooner than that, you don't have to wait till August, please.
How are we gonna end with May the 4th
Well,
with you? 'Cause that's what-
So for those of us who are here, we can continue the conversation. For everyone that's online, unless there are any final, you know, comments or questions, I guess we will wrap up, but I want to really give a hand and a warm thanks to Professor Raniga for joining us and with us. And we hope that this can be, you know, another foray into our international collaborations through the policy program here. And we would love, you know, you all heard the invitation early on to reach out if you are thinking about studying further in South Africa or doing, you know, some kind of trip there. We are talking about some opportunities to make something like that happen. So if you're interested, reach out and, you know, we will, you know, collaborate together. Janet, did you want to say something? You can feel free to unmute.
Yeah, hi, Professor. How are you?
Fine, thank you.
Yes, so I just wanted to share with you, obviously you can hear from my accent. I'm also born and raised in Gauteng and then lived in the Western Cape for many more years. I left behind children and father in South Africa, and I just wanted to share with you that one of my sons actually runs a nonprofit with very similar purposes to what you were referring to. It began with the intention of addressing poverty on a food and basic needs level. And he soon realized that if you give a person a fish, you feed him for the day, but if you teach him how to fish, you feed him for life. And so he basically works off donations from the public sector, and they got sewing machines and taught women how to sew. And many of them do that privately. They now sew for themselves and have their own businesses. And he also runs a business where he employs women, where they make fleece blankets and robes and other small articles. It's an organization known as Fingertips of Africa. It is a registered nonprofit. So I just thought I'd share that with you. And everything you were talking about is something I can understand and relate to.
Thank you. Thanks for sharing that. It's the next time I'm there, I'm going to try and visit that project. Sounds really amazing. Yeah.
Yes, yes. He has a Facebook page. You can see beautiful things there, but I can really relate to what you're saying and give tons of examples. But at some stage, it may be on the cards for me to return, and then I may take you up on that idea of furthering my social work education.
Please do.
Yeah, so thank you. I really enjoyed this.
Great. Thank you.
Thank you
very
so
much.
much for coming, Yona. Well, so wonderful to see everyone here. And thanks for your questions and for attending, and have a wonderful day and a wonderful spring. So thank you.
Thank you, everyone. Thanks for attending my presentation.
As the executive assistant, indeed, I'm always like on